Okay, what is the algorithm for diagnosis of Cushing syndrome? First of all, there should be a clinical suspicion based on history examination, which is osteoporosis, central adiposity, diabetes mellitus, hirsutism, or amenorrhea. First test should be overnight or low dose dexamethasone suppression test. If it is normal, that is dexamethasone suppresses cortisol, then there is no Cushing syndrome. If there is abnormal dexamethasone suppression test, okay, it can be seen in obese, alcoholic, or depressed individual, which is called false positive. Okay, if it is positive, that means abnormal dexamethasone suppression test. Okay, then check 24-hour urinary free cortisol. Okay, if there is no alteration of 24-hour urinary cortisol, that is normal test, that means no Cushing syndrome, and test is false positive. Okay, if abnormal test, that is cortisol is raised, this is a Cushing syndrome. Next is dexamethasone suppression test. Next approach should be to check ACTH level. If ACTH is increased, this is Cushing disease, pituitary adenoma. If it is decreased, this is adrenal adenoma. Okay, then do dexamethasone suppression test to differentiate, okay, ectopic ACTH syndrome, okay, or pituitary adenoma. If high dose suppression test is positive, okay, that means suppresses, this is pituitary adenoma, Cushing disease. If no response, that is ectopic ACTH syndrome, that is ACTH producing tumor. Okay, like in case of, okay, like in case of, we can say, small cell carcinoma. And we check ACTH level. Okay, if ACTH is decreased, that means, okay, adrenal hyperplasia, adenoma, neoplasia. And we check CT scan, MRI adrenals. In case of pituitary adenoma, we do MRI pituitary. In case of high ACTH and negative high dose dexamethasone suppression test, then this should be a small cell carcinoma of lung. We do CT scan chest. And most likely Addisonian crisis like hyperpigmentation, nausea, vomiting. Most likely treatment is IV fluids. Addison disease causes decreased cortisol, and decreased cortisol and decreased aldosterone. Aldosterone increases BP, sodium retention, potassium hydrogen excretion. When aldosterone is decreased, sodium excretion, hyponatremia.